and the unique communities that we're here to serve. But we're all delighted to be here and very excited by the new opportunities we have with a children's service that's embedded within the council, and we think it's a really exciting opportunity to improve outcomes for children, young people and their families. So what's happening at the moment? The paper asked for an action plan, and there are details about what we're focusing on at the moment in the paper, but I wanted just to pull out a few things. The first thing is we're definitely in listening mode. So we are out and about in the communities, understanding the challenges that people are facing, what they think about current services, what's working, what isn't working, and also listening to their ideas about what they think could happen in the future to make things better. So Naomi, for example, has been out about a lot in schools, building relationships with colleagues in schools who are obviously a key partner for us in children's services. And we've been meeting other organisations as well, for example, voluntary sector organisations, who as well are a really, really key partner for us in children's services. And we're using all this information to help start developing the strategies we need on the island across the whole of children's services, whether they be in children's social care or within education, that we need to improve outcomes over the coming years. So that is in progress. I wanted to just highlight also some of the priorities that we've already identified and things that we're particularly focusing on. So the first thing is around the needs of children and young people. So you may well be aware that over recent years, the needs of children and young people around things like emotional wellbeing and mental health, around special educational needs and disabilities are significantly higher than they were before the pandemic. But even before the pandemic, some of those needs were increasing. So we really need to understand in detail about what sorts of needs they are so that we can work out how best those needs can be supported. The second thing I wanted to highlight was around the service level agreements which exist between the Isle of Wight Council and Hampshire following the exit. So because the exit happened relatively quickly, there were certain services where it was identified there would not be enough time to make different arrangements. And so the decision was to agree a series of service level agreements with Hampshire for the ongoing provision of those services for 12 months. So examples of them include the multi-agency safeguarding hub, which is a really, really important element of our work around children's social care, school improvement services, educational psychology. And so one of the things we're now doing then is contract monitoring those services to make sure that the quality of support is sufficient and that the council is getting good value for money from those contractual arrangements we have with Hampshire. The second element to that is we quite quickly need to work out what's going to happen with those services beyond the 12-month point, because those service level agreements are for 12 months. And it would be wrong to assume that even if we wanted them to be extended, that the other side of our counterparty in those contracts would want to do that. So we quite quickly need to do some options appraisal around, well, what are the alternatives around that? And we also need to find out from Hampshire whether they would be willing to extend or not. So we'd need to do that probably within the next 2 months, because actually time flies and those contracts will be up at the end of January 25, and some of them will take a significant amount of time to set up. So if, for example, there were going to be different arrangements around the multi-agency safeguarding hub, sometimes referred to as the MASH, that's going to take 9 months at least to set up. And it's not just a council thing. It involves the integrated care board and it involves the police as well. So we need to start thinking as quickly as possible about those arrangements in the long term. The third thing I wanted to highlight was around workforce. So workforce, I already said that I think people in children's services are often the most important element of performance. And we need to really look after our teams. It would be right that there is a degree of anxiety, or there has been anxiety amongst some of the workforce around this change. It's a significant change. Some people have become very used to working under the previous arrangements, and change brings uncertainty for lots of people. So we need to look after our workforce and really listen to them and make sure that they can play at the top of their game in everything that they do. So that's a real focus for all of us. And then just in terms of the two areas of children's social care and education access and inclusion, I wanted to highlight a few things. although some of these things will be picked up in later agenda items. So you will be aware, as many people on the island are, about the education outcomes delivered within our schools and the sense that these could be higher than they currently are. And so that is a really key area of focus for us. And Naomi is leading on that work with colleagues and working with school leaders to understand how we can make that a real priority for us. And over the coming months, we're going to be working on an education strategy for the island. We're going to aim to publish a draft version of that by the end of the summer term. And that will include all elements of what we need to deliver a high-performing education system in terms of making sure that we have the right number of school places, that we have sufficient support for our children and young people with special education needs and disabilities, that our schools are financially viable, and that we're driving up outcomes for all children and young people, including those groups that have particular challenges in their lives. We also need to make sure that we are delivering against the safety valve agreement. That will be a later item on the agenda. And we also need to make sure that we're ready for a local area SEND inspection, which will probably happen within the next 12 months. And I really welcome that inspection because I believe that the new inspection framework we have, which is delivered by Ofsted and the Care Quality Commission jointly, is a fantastic driver of improvement because I think it really focuses on the right things. And the key thing to understand about that inspection is that it's not an inspection of just the council or just the Integrated Care Board. It's an inspection of the entire local area. But it is the statutory partners, the lead statutory partners are the local authority and the Integrated Care Board. So we need to lead that work. But it's an inspection of the local area. So it includes early years providers, schools, health providers, everyone who's involved in delivering the duties under the SEND Code of Practice. And we're going to use that as a mechanism to bring partners together and make sure that we've got an integrated SEND strategy to drive up outcomes for children and young people who have special education needs and disabilities. Moving on to the social care side, there are three key things that I mentioned in the report. The first one is around implementing the learning from the inspection of the Youth Justice Service, which happened last year. It was inspected, it was found to require improvement. There is an action plan which has been approved, and it's now up to us locally to own that and deliver it with our partner organisations in that area. The second thing is around the action plan resulting from the inspection of local authority children's services, which Dion is going to cover in a bit, so I won't say anything else about that. And the third thing is around our corporate parenting duties. This did come up a bit in the inspection, but we want to have it as a bespoke area, working with members, working with our colleagues across the council to make sure that everyone really understands their duties around corporate parenting and making sure that we're supporting those children that we care for in much the same way as we would our own children, and making sure that they're having the very best support possible. So those are the things I wanted to highlight. I'll be happy to open it up to questions.
Okay, so I've been lucky enough to see the presentation on place planning, but this is much broader than just that. It's the full transition. So I'll open up to anybody with any questions. Feel free. Councillor Outlaw.
Good evening. I'm Tig Outlaw. Nice to meet you all. I had a number of questions that I wanted to put to you, one of which you've already answered relating to the timelines on the SLAs. So thank you for clarifying that. Now, a couple of my other questions do relate to the school place planning issue. Obviously, it's quite a pertinent issue on the island at the moment. There was a members briefing a few weeks ago, which I was scheduled to attend and was unable to at the last minute, which was unfortunate, but having the paper here within the pack and then having the time outside of a online Teams meeting to consider it in a bit more detail is actually, for me, a bit more beneficial. So hopefully you'll be able to give me some answers. Now, I appreciate there's a level of sensitivity around this. Any decisions made around this school place planning are going to affect the local community, they'll affect the pupils. So I am mindful of that, but I do need to try and get to the bottom of this issue. So now I'm in engineering. I manage a couple of engineering firms, and so I'm a numbers guy. Now, according to the numbers outlined in the paper, by 2027-28, we'll have 399 spaces out of 1,319 in our 38 primary schools. That's 30.25% of the total. That's a lot. So if we were to look at that in terms of schools, that's 11.4 primary schools more than we need come 27-28. Additionally, in the information, we see that 27 of our 38 schools are considered small. And given the fact that we want to improve our outcomes, and again, in the paper, 5 times more likely for a small school to be inadequate, that says that's a big worry for me, and it should be a big worry for everyone on the island. So let's take that 11.4 schools that potentially we've got too many of, but proportionally, we have a very high number of small schools. Potentially, we should be looking at 15 schools that could potentially be closed or should be considered for closure. Now, I don't want to alarm anyone, but that is an alarming statistic. That even if we suddenly see a burst of children being born on the Isle of Wight now, and in the next couple of years, and the numbers start to creep up, they're not going to creep up by that much. So realistically, we are looking at a large number of closures, in my view, as a minimum, potentially 8 to 10, potentially a maximum of 15 plus. So coming to my question, the consultation is set out to start in April. How honest a consultation is it going to be? Because I think the people of the Isle of Wight do need to know how potentially impactful this could be to their local communities. So if you could enlighten me, please.
Thank you, Councillor, for your question. So one of the things that I've been really pleased about since I came to the island was how engaged people are and how knowledgeable they are about certain issues. And I think what you've highlighted there is this is a very complex matter. And I absolutely recognise, and we all recognise, what a sensitive issue this is. For our children and young people, for their parents and carers, our communities, and indeed for the staff who work in the schools. It's a very sensitive subject, and rightly so. It's a very important topic. Just so we're clear about the timeline of events. So in April and May, those events are not consultations. They are engagement events where we will be out in the community, providing information and helping people who come to them, who may be young people or parents and carers, or school leaders, etc., or school staff, so that we can help them understand the reasons that we believe that this change is necessary. So it's not a consultation at that stage. It's essentially an opportunity for us to share information with people to help them understand the reasons why we believe this is necessary, but also to listen to them so that we can include people's comments and feelings and thoughts in the next stage. So we believe that when we need to go to consultation will be in June. And the purpose of that consultation, to be confirmed, because this is a draft timeline in the pack, we'll be consulting about the drivers of the decision. So when we have to decide which schools we believe are most appropriate to close or amend, we need to be really clear with everybody about the mechanism, the logic behind that decision. So we want to be clear with people about how that decision will be made, and that will be the subject of the consultation in the June consultation. So then the next stage of the consultation will be in September, according to this draft timeline. And at that stage, we think we need to get to a stage where we actually name schools. So that would happen in September. There would then be another consultation specifically about the schools that had been named. So in terms of your question on how honest and transparent this whole process will be, I believe that it needs to be as honest and transparent as it can possibly be, which is why we have started, bearing in mind we've been in post 5 weeks, and we gave the presentation to all members who were invited, I think 2 weeks ago. So we'd been in post 3 weeks. You know, we believe it's really important to be transparent. I think that's absolutely in line with one of the key principles of the council's plan, the wider council's plan, and we'll continue to do that. So we met with the chairs of governors of school on Monday evening. We had a very encouraging turnout, again, really good engagement, lots of questions about it. We've spoken with head teachers about it as well, and we're going back to see head teachers next Thursday morning to make sure that they're updated on it. So we are committed to being as transparent and open about it as possible. I can also say that we are doing, this is a whole island approach. So I know that there have been a number of discussions about this in the past, and there have been discussions about particular schools. We're starting with a blank sheet of paper. This is a whole island strategy, and you know, that's how we're going to approach it. And the thing I'd also like to emphasize is that this school-based planning piece of work is just one element of the wider work that we need to do to drive up outcomes and the quality of education on the island. And I hope this comes across in the pack. There's a number of reasons that we've explained in there about why we think there is no alternative to making these changes. And though I don't know exactly at this stage what those changes will be, but really the crux of it is that the Department for Education funds schools in a certain way. We might not like that, and that may change in the future. But if it remains as it is, schools are basically funded on a per child basis. So if you are a small school and you only have, let's say, 10 or 12 or 15 children in a class, and you have a teacher in that class, you literally have, you know, if you have 15 children in a class, you get half the funding that if you were 30 in a class. And that makes it really hard for the school to be able to access the resources that it needs to provide a high quality education, a rounded, rich education that our children need, not just about academics. And so the way that schools are funded means that there is an element of economies of scale to it. And bigger schools are able to access, you know, they're able to benefit from those economies of scale in the way that a small school can't. Now, one of the things I think that we need to pick up in the work that we do is, you know, include consideration of the community element of schools and the fact that, you know, we have rural schools, we have schools in urban areas. And that's part of the complexity of it, because obviously, you know, certain schools close, it might increase travel time, which brings a cost to it. We need to incorporate the costs of that in it as well. But also, we don't want children spending lots of time traveling, because, you know, I know at the moment, for example, I was in a school recently where children with additional needs were arriving on transport who'd been in transport for well over an hour traveling to school, and it was going to take them at least that to get home again. So this is part of the complexity of the decision making that we need to do. But the reason I think we need to do it to this timescale, and we can't afford to let it slip, is really two things. The first thing is the longer we let it run for, the longer it will take for schools to be able to be in a stronger financial situation, and to start working, you know, in a different way with improved financial resources to drive up outcomes. And the second thing is that as a council, when a school closes, if they have debt in that school, the council inherits that debt onto its balance sheet. And the financial modelling that's been done by schools and is done as a matter of course shows that over this financial year, there are many schools that are in a financial deficit, so they're loss making on an in-year basis. And more schools will be in that situation as their pupil numbers decrease over time. And if you wind the clock forward a couple of years, there's a significant number of schools that will be in debt because they will have been loss making for more than 1 year. They will have exhausted their reserves and they will be in debt. And what happens, if one of those schools were to close, that debt would be inherited by the council, and the council would need to realise that debt, and it would need to include it in its wider budget planning. And to just give you some rough numbers, if nothing were to happen, within a couple of years, the council would likely be taking on several £1 million of debt from schools that were in deficit. So that's apart from the issue around young people's outcomes and driving up education standards. There's also the matter of just financial viability and the financial impact that the council would inherit if that wasn't resolved itself. So I hope that answers your question.
A supplementary on that, because the last point you made is I think quite an important one. On page 25 of the paper, it says by March 2026, it's forecast that 21 of the primary schools would be in budget deficit. Primary school deficits are estimated to be a cumulative 3.8. Now, I read that as primary school deficits are estimated, means that they are already 3.8 million.
It is estimated that they would grow to 3.8
by March
by that time.
Okay,
yes.
that's the point I wanted to clarify. Thank you.
Councillor Bacon, and then I've got Rob Sanders.
Sorry, Chair, I was trying to grab your eye while Mr. Whitaker was talking, just to some extent the point was covered off, but I think as Mr. Whitaker said, it is a very complex process and a complex range of considerations, and there is a problem if one purely looks at this as a numbers game or a financial game. The list on page 21, perhaps it's part of the presentation, I'm sure Councillor Atwell's seen it, but that indicates a non-exhaustive list of considerations, and I'm glad that at least one of those was highlighted. The fact about considering, do schools serve their local community, and the importance of that, whether they're large, small or otherwise. So, as I say, I think there's a risk of taking a narrow view by just looking at one or two sets of criteria when there are far more to be considered. And as that list says, the last item on there, showing it's non-exhaustive, further factors that might arise during the consultation process. There are things that we haven't thought of, I'm sure, and we will hear those. That's the point of that initial process, and those will be taken on board before we get to any assessment of numbers or particular identities. Thank you.
Rob.
Thank you, Chair. Yeah, it's good to hear that, because I know of some very good and outstanding small schools. So although I can understand the rationale around some of the reasoning around how larger schools can be more effective, small schools can be equally effective as well. So I'm glad it's not just going to be a sort of narrow set of criteria. And my question really was, I've got a couple if I may. One, I understand there's sort of a recommended percentage surplus that a local authority should have in terms of school places. And I wondered whether that was an arbitrary target for you to get down to, or is there an end point you're hoping to achieve in terms of percentage surplus? And if so, potentially how many schools would that involve, and would there be a phased set of closures, or are you looking to chop quite a lot at one point? Because I imagine that'd be quite a significant impact on parents and choice. And my second question, just around the School Improvement Service, SLA, will that mean schools will be able to access the same quantity of support, amount of support as they have previously, or is this SLA going to mean a slightly reduced amount of services available to schools? Thank you.
Thank you for your question. I'll answer the first one and then Naomi will answer the second one. So just a comment on the small school situation. We absolutely acknowledge that there are some small schools that are very high performing on the island. And again, that adds to the complexity of the decision making. In terms of your first question, it's going to be a very short answer because we haven't got to the detail of that yet. We're in listening mode, and it would be, we have not made decisions about anything like this yet. So that's an example of what I said before. It's a blank sheet of paper. We're going to listen to people. We're going to talk to people. We're going to understand what the issues are, and as we do that, we will develop things like, what is the target number that we will get to. But at the moment, we are not yet at that stage. I'll hand over to Naomi for the question on school improvement.
So in terms of school improvement, we've carried on with our SLA with HIAS, the Hampshire Inspection Advisory Service. Schools will see no difference in the level of support that they have received for the last few years. We are continuing with the LLP process, which is the quality assurance process that schools have around support and challenge. We also are carrying on with the CPD offer, our continued professional development offer, with core work around phonics, English, reading, maths, writing, science and some foundation subjects too. And then we're also doing bespoke work for schools which are have performed less well than their peers, so that we can do some targeted work around target setting, Venn diagrams, which I was going to talk about later, and some of the areas that are not as well performing. So the offer is exactly the same, if not more bespoke this time round, and it's very targeted. But there's no reduction in the quality or amount of work there.
Okay, thank you.
Councillor Churchman. Sorry, Rob, did you want to come back?
No, thank you for your responses.
Councillor Churchman.
Yes, I think what makes me really cross is we have known for at least 3 years that the school rolls were falling, which was why Councillor Brading amalgamated 3 schools in the West White. We have done nothing. Now we're doing almost too little too late. The amount of money that it is going to cost us because schools are in deficit is appalling. Where is that money coming from as far as the council is concerned? I mean, every council in this country is struggling to make ends meet. So the longer we keep schools open that really shouldn't be open, the greater the amount of money. I would think it's extremely difficult to recruit staff into schools where they don't quite know what is happening. Will this be open next year? Will that one be shut? Trying to get staff to work across more than one school, I think, is very few people are capable of doing that. That means that the basic education will and does suffer. But I think one of my biggest problems is how do we staff any schools on the island when we are in this dilemma, for want of a better word? How do we attract staff to the island to teach? Because we do not have enough teachers. I know at Haylands, where I'm a governor, we struggle. I just feel that to have to wait until September 26, am I right? September 25 before we come out with, but when will that then actually affect the intake of children? Will it be 26 or will it be 25? It will be 25. One other point on page, I couldn't make some of the figures work. Page 24. We've got surplus capacity 291. The first paragraph underneath says we have 1,898 vacant primary school places. Well, where does that nearly 2,000 primary school places come from?
Sorry to interrupt, but I think that's based on capacity of schools, and the figure of 291 is the slowly slashing the numbers each year. So the schools are capable of another 1,800 kids, but we've slashed pupil numbers in terms of their allowable role every year. Correct me if I'm wrong.
I'm quite happy to answer that. Yeah, we've had, over the last few years, school leaders have been working with local authority reps to reduce their PANs down to try and resolve this issue. So we've got a number of schools with odd PANs of 15, 20, 45. So the numbers do change in terms of those numbers on roll, but it means that ultimately we have surpluses of places now and then a rising need later on. So that's why the number's so large. That's why we've got to act.
It would actually be cheaper to shut the schools now and bus the children into schools. But what
We could
really
do that.
worries me
should.
is the staffing, because I know that we are struggling. And trying to attract teachers from the mainland isn't easy, not just because we are where we are, but of course, housing. You know, all these things interact and you can't divorce one from the other. Thank you, Chair.
Fine. Just for clarification, head teachers made the council in 2018 that the roll numbers were falling, not the last 3 years, just in terms of the numbers. And it's good debate. But just I think most of what you've said, Vanessa, is covered in the actual in-life presentation. And I'm not one to answer on your behalf, but I believe that is central to all of the concerns in terms of staffing and the like. And I believe you mentioned that. So feel free if you want to add to it, but don't feel like you need to.
If I can add just one thing on that, I'm working with the Isle of Wight HR department around sustainable schools project and some recruitment initiatives to address those issues that you discussed. I think that there are different ways that we can attract people into our schools. We've done a piece of work with Steph Gleeson at St George's, and from that piece of work, we've already seen an increase in the number of teachers applying for roles because of the way that we've rephrased the adverts. And we're working with her extensively on some of the things that are happening moving forward. So working with head to help with this issue, especially during this next year, while it's going through the place planning process, is key in keeping those relationships moving forward. Once we have closed some schools, we will have a range of teachers that we can actually deploy and redeploy into the schools that are left open too. So we'll be in a better position. We are looking at doing some training with the universities around that initial teacher training and the leadership development opportunities so that we can address that high quality entrance into the market. So it's on our agenda. It's going to be forming part of our education strategy, and we're very aware of those issues that you raise.
May I make a quick point?
Quickly.
Very quickly. Actually, it's not the children will have trouble with moving, it will be their parents, because kids after 1 week move into a school, settle down. Thank you.
Got Matthew, then Councillor Downer, then Councillor Lever.
Thank you, Chair. Nice to meet you both. Nice to meet you again. Just two questions really. Councillor Outlaw made mention earlier on of effectively 8 to 15 schools being closed. Is that, I know it's obviously early days, but is that a realistic number, do you think, from your point of view? And the second question is, you also commented you don't want kids to travel, but what about the quite large amount of parents who choose to travel because they want to go to a specific school?
So the answer to the first question is I don't know. Really, we're not doing the analysis at the moment. We're out there listening to people, understand their local context. So I don't have a view on what the number will be. And in answer to the second question, you're right. So there's an element of parent choice in all this. It's not just about measuring where someone lives to where they want to go. It is true that some families choose, happily to travel quite some distance to do that. There may be increased transport costs for the council if we have to take people to schools further away from where they live. And it may be that if a school closes, which is close to where someone lives, they currently are able to walk to school and they won't be able to do that anymore. And that's regretful. And that's an example of how this whole process is going to be difficult. I think it's important for people to understand, and I think it's come through loud and clear that this is going to be a difficult process. It's going to be difficult for children and young people, for families, for communities, for the workforce. There is significant uncertainty about it, and You know, if we didn't have to go through this, I think we would all choose not to go through it. But I think it is in the best interests of children, young people and families long term on the island to do this. It's going to be difficult, but we are confident at the end of it, we will have an education system that is fit for purpose for the island for the future, for children who are in the schools now, who will be going to the schools in future years, and that it's the right thing to do for children and young people.
Thank you very much. I don't envy you at all.
Councillor Downer, then Councillor Lever.
Thank you, Chairman. And I was pleased to say that in your introduction, Mr. Whitaker, you was on about talking and listening to people. That's really refreshing. The other thing I would like to ask is about the MASH. If it comes over here, have you already started preparing for that eventuality? And the other question I ask is about the SEND, the SEN. How are you going to make sure that all the parties communicate to each other and don't just work in silos? Thank you.
Thank you, Councillor. So on the MASH, we have started thinking about what the options are. So the options are basically find out if Hampshire, if it's an option to carry on with Hampshire. We may or may not want to take that up. Another option is to bring it in-house. If we brought it in-house, I think we'd probably join in with adults. So we've already started talking, so I've spoken with my colleague, the Director of Adult Services, about that, because they have an in-house MASH, which is also supported by the police and the Integrated Care Board. So it would make sense to do something with them rather than have a standalone children's MASH. And the third option is basically to partner with someone else instead of Hampshire. I think that would be complicated and would take a long time to set up. So what we're aiming to do is to have an options appraisal for those three options essentially within 2 months, and then we're going to need to make a decision because it may well take 9 months to set it up. So I'm, for example, meeting actually with my equivalent somewhere else on Monday to talk about, you know, that as an option as we explore the options. In terms of special education needs and disabilities, I'll go back to what I said about the inspection framework. So because the inspection framework relates to all partners who are named in the SEN Code of Practice, which includes health providers, the Integrated Care Board, the council, schools, colleges, early years providers, and everyone else who's involved, I think it's a really good mechanism to bring people together. And I would say that I actually think a lot of the communication between partners to do with special education needs and disabilities is actually quite good already. I mean, there was a conference at the end of last year, which I understand was well attended. And so there is already some good partner working going on between different partners. I think one of the things we need to be mindful of is the amount of change that's happening outside the council at the moment, not just to do with school-placed planning, but also to do with changes in the delivery of NHS services on the island. So if we think about Project Fusion, we think about the changing arrangements between the Island Trust and with the Trust on the mainland. These are all changes that affect children, young people and their families who have special education needs and disabilities. And so for those partners who are perhaps distracted by all that structural change in their organisations, we need to deliver all this change and improvement in that context. So we need to be really aware of that and work our way through that complexity. But it's another example of where the amount of transformation and change we're looking to deliver in the coming months is being done in an environment where there is going to be lots of change, and a lot of it's out of our hands. But if we think about mental health services or diagnosis around autism and the like, all these things will be undergoing change because of these changes within the NHS. And we're going to need to work with people closely on that.
Well, thank you very much. And may I say, it's very refreshing that you're speaking in plain English.
Thanks, Rodney. Councillor Lever.
Thank you, Chair. Hello. Two questions. The first one was just clarification on the actually the inspection of the SEN provision in the local area. When is that starting? Sorry, is that already begun?
So the local area was last inspected in 2019, and they're now inspecting under the new framework nationally, which started last year. We don't know exactly when we'll be inspected, but I would imagine it will be within the next 12 months. We're going to start a inspection readiness group. It's either going to be at the end of this month or it'll be in April after the Easter holidays. But certainly we'll be putting that together as soon as we practically can. But because it involves partners from across the whole system, that's why logistically it's quite difficult to organise. But we're trying to get that in the diary.
Yeah, great. And then it might be perhaps unfair to ask this, seeing as how new in the roles you are, but what are the biggest challenges you've identified so far? And I guess, have you identified ways to overcome them at this point, or is it too soon to say?
That looks like a big list that's coming out.
So I think we've already talked about some of the challenges, haven't we? I mean, workforce, maintaining people's focus on their most immediate priorities, which are supporting children, young people and families when around them there's lots and lots of change. Recruitment to schools when there's uncertainty going on. But, you know, some of the other things I think are around the needs of children and young people, which continue to change, continue to be high. So if you look, for example, at the numbers of young people who are, you know, coming into the children's social care system or who are being assessed for an education healthcare plan for their needs to be met, you know, it's high. So that's going to be a challenge because there are finite resources and that is not just a money thing. It's also physical availability of people. So if you think about educational psychologists, I mean, around the country, there's a shortage of educational psychology. And the need for them is growing. So that's a problem. So needs of children and young people, the service level agreements we've talked about, the workforce we've talked about, actually partners and the changes that are going on in partners like the NHS is a challenge. And then, so I guess finally, it would just be about the capacity that we have within children's services to deliver all this, because transformation and really significant transformation like the pieces of work we're talking about isn't something that can be bolted onto someone's day job. It needs focused resource to deliver it. So if you look at why programs of work sometimes don't work, and then people have a drains up at the end of it and say, well, why didn't that happen? Often it's because at the beginning of the process, they hadn't invested enough in the resources required to deliver that change. And so one of the things we're thinking about at the moment is actually what resources do we need to deliver this? So if we just take one of them, let's go back to school-based planning again, you know, the setup of all these engagement meetings, the analysis that needs to go on to collect all that information, interpret it and work it through, to run the consultation. This is all additional work. If we think about special educational needs and disabilities, the work that we need to do to work with mainstream schools to support them to be more inclusive, be able to take needs of children that they can't currently deal with, expanding provision, developing special, this is all additional work. So there is a concern I have around the capacity of the service to deliver all this work, which I have discussed with colleagues in the council. So we're looking to solve that. I think some people might say, well, why don't you just do this bit and push that down the road and do it later? I don't think we can do that. I don't think we can do it for a number of reasons. The school-based planning thing, we've kind of covered the financial bit, but more importantly than that, this is about children's and young people's experiences and outcomes, and children have one go at going to school, don't they? And if we can make improvements, we need to make them as quickly as possible, because otherwise for some children it will be too late. So that's why I think we need to keep this sense of urgency around it and navigate our way through this difficult landscape. But those are some of the challenges I think we've got.
Councillor Outlaw.
Yeah, just to quickly, I have a question for the cabinet member relating to this topic. Can we do it now or leave it till the end?
Do it now because Councillor Bacon needs to go to Brading Town Council. Yes.
Thank you. Yeah, okay, so it relates to the overall transition of the children's services. Back in July last year, when the decision was first mooted and then confirmed by the cabinet, I believe in September, there was some fanfare in the local press relating to the delivery of the children's services by the Isle of Wight within the same financial envelope as was costing the contribution to Hampshire. Can you tell me how that's going?
I think that's actually a question that's easier for Mr. Whitted to answer. I believe the statement is accurate, it was made then, but I couldn't give you precise figures. And it may be something we actually have to do by a written response.
Thank you. We will move on because I always like to run over time by at least double on the first item. So, but I think it was important, to be fair, and I think that was a good debate. So thank you all. Item 7, Ofsted inspection. I mean, the fun never stops, does it? Who's taking that one?
Thank you. So I'm presenting in respect of the Ofsted inspection, which, as people will know, took place between the 30th of October and the 3rd of November last year. And really positive news is that overall children's services were found to be good. And within that, many areas of strength were identified. So if I just run through some of those, particularly highlighted were the effective early help services and the provision and support to families, the comprehensive assessments that take place within the children's social care, and the direct engagement with children and young people in social workers' work with children, the strengthening parenting capacity and education support, and that's delivered through a number of programs that are offered to families here on the island, and that has allowed many children to remain at the consequence, and that we have good effective support for children who go missing from school or are not in full-time education. Overall, good and consistent care offered to children in care and with support for foster carers, and that we have running the services of resilient and adaptable leaders, and that this has really been affirmed, I would say, through the attitudes and delivery of services since the conclusion of the partnership. We've really seen how that commitment has impacted good approach to ongoing work since the partnership came to a conclusion. People have shown an ability to navigate change effectively and adjust strategies as needed and address the evolving needs of children. Also noted was the informed and supportive corporate and political leadership provided, all of which has been aimed at improving outcomes for children. So they're really positive highlights throughout the report. What we also need to note is that in the last inspection in 2018, there were 4 areas highlighted, 2 of which I would say haven't been picked up in this, and actually comments through the report suggest that those areas have been addressed. There were 2 areas that still require work, which is around quality and oversight of children subject to pre-proceedings plan. That's the work we do with families before we get to the point of court. And the recording of reflective discussion and actions to progress plans in case supervision records. So that speaks to the quality of supervision that can be offered to children. And I think it's important to recognise that that's in the context of the last inspection taking place before the pandemic. Since the pandemic, there have been challenges with workforce. There have been reduction in amount of social workers, and there has been an increase in need. So in terms of that, managers are managing more, and the ability to spread themselves across the range of work is something that I think the inspectors have picked up on. That said, we have got Another area that requires improvement this time, which was not the case previously, and that's for children in need of help and protection. And I think that links very much to what just highlighted in part around workforce. So all LAs, local authorities, are to prepare a response, an action plan following an inspection, and we have 70 days in which to do that from the date our report is published. So we have to do that by the end of March. And there are a number of headline recommendations for us. So there is the routine inclusion of local authority partner agencies in terms of strategy discussions and assessments. That this is an area for our multi-agency network to take responsibility around in participating in those key discussions for children, and making sure when we're worried about a child, we get together, we have those meetings, people attend prepared and have the information necessary for good decisions to be made for children. We're working with the partnership around this as well, so that our multi-agency partners work that we are now doing becomes embedded in practice. We're also looking at training needs both across the partnership, but also in terms of our own internal learning and development. So making sure that we've got a good training offer to address some of the areas identified within the report. We're also setting up a meeting with operational managers from across the partnership that will take place on a quarterly basis, and we'll be dip sampling our work to make sure that we are making the improvements necessary, sustaining those and demonstrating impact. Next, we needed to focus on the opportunity for the voices of children and care leavers to be heard at all levels throughout the organisation. We're all corporate parents. We all have a responsibility for children. We need to make sure that those children have the chances that we would want for our own children, and that we need to work together to really make sure that that happens. In order to do that, we also need to make sure that we're listening to children. So the listening mode absolutely extends to what are children's experiences of our services. And so we need to refresh our arrangements, and we've begun the work in terms of our corporate parenting board. We are having a session with members next month ahead of a refresh board taking place at the end of April. And that is going to be located in a different venue, likely to be the Isabel Centre, likely to be aligned with Come Dine With Us sessions where young people attend, and it will give that opportunity for there to be some interaction and opportunity for people to hear young people's voices that way. Equally, we have the Bright Spot surveys. We also have a range of other activities like the Star Awards, the Have Your Say weeks, and the opportunity to hear from the Hearing Young People's Experiences group. So a number of different opportunities will be offered whereby there is that scope for young people to be listened to and to share their experiences and talk about how they can be involved in shaping service delivery going forward. We are working around the pre-proceedings process and the other discrete areas of practice that were highlighted, which were around permanence for children and private fostering. We've put measures in place, including tracking panels, to make sure that these are having the oversight from senior leadership, and that the plans for children are being tracked and the quality of those plans are also being monitored, so that decisions are being made for children in a timely manner and that we are progressing things for them. So decisions are made quickly and they know where they're going to be living ultimately at the earliest opportunity, so they can settle into wherever alternative homes if need be. Private fostering was an area picked up. Just to say, we have very small numbers of children who are privately fostered, and at the moment there are currently none. I think there was one confirmed at the time of inspection, and we now report on that monthly in performance meetings so that we are again tracking this. Caseloads for children's assessment and safeguarding teams, I think, is a big area that we've needed to address. And I'm pleased to say that actually there has been a reduction, and partly that's due to some really targeted work around recruiting social workers. So a number of locum social workers have joined the service since December, and I think by Monday we will actually have only one vacancy in the social work teams. So that's fantastic work that's been done. That means that caseloads are being brought down, and so we are seeing that reduction to more manageable caseloads. It's something that needs ongoing monitoring, and will continue to be something that is picked up and addressed through the strategic performance meetings that are now being put in place, because it's critical for us to do good work. So I think ultimately to say that we've got other systems being implemented to address some of the other areas that were highlighted in the report. New ways of working are going to be captured under our umbrella heading of creating change together, which is what people have decided is how we want our work to be seen and the umbrella by which it will be done here on in. For our next actions, we will be finalising the plan that's currently draft, and we will be submitting our finalised plan once that is achieved, and that will be submitted to Ofsted by the 27th of March, which is the deadline. That will then be updated ahead of an annual conversation that we have with our Ofsted colleagues in that takes place in July this year. So our plan will be updated in June. And to note that we have some big changes in terms of our service as well. We've got an implementation project, which is really important for the children's case management. That's happening later this year. I think that's, I'll leave it there for now. If I'm happy to take any questions.
Councillor Outlaw.
Thank you. I've got a couple of brief questions, I would imagine. So just to clarify for me, the first one, that the action plan is submitted. It looks very thorough. I confess it means very little to me as a layman, but it looks thorough. So that gets submitted on the 27th. You then have a conversation with Ofsted. So I guess they review it, do they? And then they feed that back to you and it gets updated for June. So that's my first question.
When we submit the action plan, it will be reviewed by Ofsted. They will let us know if they have any in respect of it. They expect is that we take measures to address those actions. So when we meet with them live, we will be giving them an update on our.
Okay, thank you. And the second question is a bit more, I mean, the difference, I'm assuming there is fostering and there's private fostering. I don't understand. Can you explain to me what the difference, what is private fostering as opposed to fostering?
Private fostering is when arrangements are made privately between a parent of a child and somebody else who is not be a relative in legal terms. So that it can be a relative, but it's the distance apart from, so not a grandparent, not an aunt or uncle. So it can be a relative, it can be somebody else known to the family. They make the arrangements between themselves, and it's where the child is there for 28 days. That counts as a private fostering arrangement.
Any other questions? Councillor Churchman.
Just a quick question. We're talking about looked after children and fostering and everything. Once a month, the team used to hold a Monday evening where they used to do a little cookery thing up at thing. Has that now stopped? And during August, at least 1 week in August, a whole week would be set aside to take these children on different things. They might go to the zoo one day, they might go horse riding. I haven't seen it because I was always very interested in the looked after children, and I always used to make a point of going. But I haven't seen any of these things being advertised or happening.
Thank you. And I'm pleased to say that the cookery is ongoing. So since I've been here, I've had the pleasure of going and cooking young people. Along with Mr. Whitaker, we were involved in making pasta bake and cooking. So it was a really important event, and it allows you to have a conversation with young people in a very different way. And so I think these events are really important, and it's good to hear that you're inquiring about them, because we want these to be supported, and this is where we can really have meaningful conversations with young people, and you can find out what's needed as we develop our services going forward. There are a range of other events, and I think that this relates to the item that has been rolled forward, but we will be addressing is the list of events that are available for that interaction to take place, where young people are very much going to be involved.
May I come back, Chair? Just there, I'm delighted to hear that, and don't forget the allotment of Ventnor, except that, of course, the children probably can't get to Ventnor because of Leeson Road. It suddenly occurred to me. Anyway, is it possible to have a list of things? Because currently I have only just come back on Children's Services Committee, so I lack the list of what is going on. I'd be grateful if I may have one, please. Thank you.
That was the action from the progress report, is the what's happening. Thank you. I have one question. The report is very thorough, as you'd expect with Ofsted. I imagine you all have much joy not sleeping when Ofsted come in. I mean, the report is great. You know, your plan is very thorough. What do you see as the handbrakes and the potholes to actually implementing the plan? And it's unfair because you won't be here, but it may be one for Ashley or Naomi. But because there's always, you know, everyone's got a plan until they get punched in the face, as they say. What is going to be the thing that we can help with as a committee?
Thank you. I think it's a great question, and the reality is that this plan was produced by the management team collectively, so it will matter to everybody because they are very invested in it, beyond my departure in a couple of. So in terms of the areas that are really important to maintain focus around, making sure that we've got the right numbers of people in the right place to deliver a good service. And you want caseloads to be manageable. You want managers to have a reasonable number of people to manage and not be too stretched. So it will require that we need to look at how the service is shaped at the moment, and that's certainly a conversation that we've already begun. And but it's absolutely critical to being able to take the service forward in the way that people want to. The commitment, the will is there. Some actions in the plan are really simple, straightforward, quick wins. Some will take a bit longer to achieve. As always, none of it is not achievable. It's all in there because we can do it.
Thank you. And please.
Thank you, Councillor. If I can just emphasise, I think something that Dion said, and it's about people, because essentially there's two sides to the equation, aren't there, in terms of caseloads. There's the staff we have and the quality of staff that we have, and then there's the number of cases. So the needs of children will determine, you know, how many cases there are, and we can control as much as possible the staffing that we have. But it's kind of those two things, isn't it? So that's why, you know, workforce, absolutely key. I said at the beginning, that's one of the key priorities for the transition. And the needs of children, I also mentioned earlier, you know, that's the driver of it. And so the more that we can work with our partners in the early help space Particularly, I know that a lot of communities are being affected a lot by, cost of living crisis, etc., and the impact that that has. But the more we can work with all our partners, for example, in the voluntary sector at an early help stage, to prevent those needs from escalating, the less cases will escalate into a statutory level. And then, we like to have less challenges around having enough staff, which is, as we know, sometimes difficult to recruit to.
And I would say, whilst this is scrutiny committee, it also has the word policy in it. So if there's anything we can help with, please don't feel that you can't bring it to the committee. Any other questions, or should we move on? Oh, good, we'll move on. Thank you for that. Item 8, school attainment.
Thank you very much. So I'm not going to labour this too much because obviously we inherited these results, and these results came out from the summer. So they've been out in the public domain for quite some time. And just to start off with, in most measures, in all measures, the Isle of Wight is below national average. However, in all of the measures, we have seen improvements, which is a pleasing picture. I just must point out, though, we are only 6 weeks away from the current that test that the primary age children will sit in the end of year 6, and there isn't a lot we can do that's going to be meaningful in this time to make a difference to that cohort of children. So this is a quite unique period to start in terms of that transition and analysis of previous years and this coming year. But what I would say is we have used the data that we've analysed so far to craft a school improvement package for this coming year, which it always starts in April because that's the start of the financial year. And if I can draw your attention to page 107, this is something that I picked up when I actually came for my interview. So Ashley and Councillor Bacon will be probably bored of me saying this, but there is some really good news stories in the data, especially at Key Stage 2, which I would like to elaborate on, and that is that the combined outcome, which is low for the Isle of Wight, 52%. If you look at the individual scores, which have increased, if everyone that got writing, if everyone got reading and writing and maths, got the lowest common denominator of 64%, we'd be above national. And that is a pattern across all of the Isle of Wight schools, that you've got quite good individual scores in reading, writing and maths, but they're not the same children. So we've targeted our higher support on 2 aspects. One, on the combined and targeting pupils more forensically, so that we can, if you use the Venn diagrams, you can actually see which children are getting maths, which ones are getting the writing, which ones are getting reading. So we can actually start pinpointing and targeting how many children may or may not get that combined measure. The other aspect that impacts upon that is the small schools. If you're a pan of 15, each child's worth about 6%. That's a huge percentage point for each school, and which can show the fluctuations year on year. So we need to do some work around it, making sure we're really clear how many children in each school will make the difference. And then we're going to focus on SEN support, and we're going to provide each school with some support around that for next year, because most schools are telling us that they are struggling with meeting some of the more complex needs of the children whilst trying to raise attainment across the board. So we're going to do some work around the targeting for everyone and the SEN offer across the board to improve provision for children. So it's a work in progress, to say. I don't want to go, the results are not where we want them to be, but it is part of our education strategy moving forward, in terms of not just using the higher support, but using the English hubs, using the maths hubs and the other DFE approved programmes that are out there. So we have a blended model. The 2 other points around that, though, is I'm very conscious we can throw a lot of support at schools and it can become overwhelming. And we are going into a place planning phase, which is already causing anxieties in the system. And part of my role has been going out and actually sitting with leaders and listening to them. And I've spent the last few weeks doing that. And I was out yesterday and visited 2 leaders because they were quite anxious about this process and going forward. That will have a knock-on effect on the whole school system. And I can't, I need to emphasise that, because, we're going to be sat here next year and the results may not have improved. And we've got to factor in that there's a lot of things going on that will affect our school system. And the place planning will eventually improve, but we've just got to stabilise it for this coming year. So Dean and myself are out most days visiting school leaders, talking to them on the phone. They know that we're here. I'm sending regular emails out to them. I'm making sure that we're celebrating the good things that are going on, which there are lots of in our system. And when you look at those individual scores and you go round the schools, I see some fantastic work in books. I think we just need to be a bit more strategic around how we target it and support leaders with that. So that's really my intro around the attainment report. I'm happy to take questions. It's a really big meaty issue, and what I would say moving forward, you will get more information from me.
Thank you. Questions? Councillor Lever, then Councillor Beck.
Thank you, Chair. Just a quick one. Obviously, a lot of this is comparing ourselves against national. How good or fair a comparison do you think that is to make? And are there other comparisons we should be comparing ourselves against?
It's a really good question. It's really hard because if you were on the mainland, you compare with your statistical neighbours. We have none. Our children are our own. We don't cross the borders. We do have children that leave the island, and we have children that come onto the island. You know, I sit with them every morning. But in terms of comparison, there aren't many that we can actually do anything that's meaningful with. National is what we need to use in terms of that measure, but we're always going to look for, and I think that there is movement we can do to make it better, especially when I look at the individual schools. We've got schools that are getting 90, 90 and then 64. So they're overall 64, but they're doing something right in the other two subject areas. And that's a few schools that are doing that. So we need to help them raise it where they have got an area for development and target set more forensically so we can actually improve the schools overall.
Rodney.
Yes, thank you, Chairman. I'd just like to ask about SATs and all those various tests. Are children prepared for those, and especially the ones who suffer from anxiety through examination? Thank you.
Yes, we do a lot of preparation for SATs and their GCSE exams and other examinations, and we do a lot of walking, talking mocks. So we prepare the children, putting them into the environment beforehand so that they don't get panicked when they first go into that environment. We try to get them used to the room and that's, you know, that experience of being with your peers in a different environment. What you can do sometimes, though, is you can hothouse children too much at the expense of some other subject areas. And we need to make sure that we have a broad and balanced curriculum that all children experience. So there are, you know, we do prepare children, but we've got to be conscious that they are getting that whole broad curriculum too, not just reading, writing and maths.
Matthew.
Thank you, Chair. When you talk about the small schools problem with stats in SATs and where one underachieving child is worth 6% and stuff, when you've got so many small schools, how do you cope with that? And how do you interpret results in such a way that actually is a realistic view of what's going on rather than just there's 2 underachieving kids in that class and that class, so everything crashes down?
A really good question. We're just doing some more further analysis on this current or last year's exam results or outcomes results because it feeds into the place planning work, and we want to show where those results are having an impact. It's really difficult on the island because of the various PANs you have. You've got lots of different PANs across the whole system. So we can compare 2 form entries, but you've got very few of those. Most schools are a 1 form entry, and even those you've got 20 and 15. But it is a factor we need to consider. It's not just about, this can affect high performing schools too. If you have a child that's ill and then they're out of school and they aren't able to sit their SATs, they will then impact poorly against that school. And when you talk to school leaders, there are a lot of really good reasons as to why they did not achieve in certain areas. And it can be down to a child missed 1 paper, but sat the other 2. So that does impact upon the outcomes. And as we move forward in this place planning phase, we should be able to analyse the data more meaningfully because there will be more synergy across the system.
It's encouraging to say celebrate achievements we're seeing, but also celebrate as we're going through this massive change. We're going to need to celebrate schools, but something, and not wanting to put words in your mouth, but it's not accepting average or average being the minimum is a very encouraging thing as well. So thank you for that. Any further questions? No, we're motoring along now. So item 9, safety valve.
Again, okay, so we entered into a safety valve agreement with the DFE. So just to clarify what that means, local authorities up and down the country are struggling with their high needs block and the deficits that are accruing due to predominantly special educational needs, transport costs associated with those, and the placements of children. The Isle of Wight is no different with that, and the government set up two main schemes: delivering better values and safety valves. Safety valves, the authorities with the highest deficit as a percentage of their high needs block. The agreement is if we can get to a balanced, but an in-year balanced budget by the end of the safety valve agreement, which vary for local authorities, the deficit that had been accrued will be wiped. The DfE will pay that off. So when we went into the agreement, it was around 12 million pounds. If we can actually address the overspend on the high needs block, the DfE will remove that deficit for us. So if we assume that we've got a zero-based budget at the beginning of the programme, because it's the easiest way of explaining it, we went into it a year ago, but the agreement was signed and backdated for a year, which is unhelpful. It was set on a number of parameters that we had to reach, and over the course of the last year, we have had a deficit that has started to accrue. I have asked the DfE whether we can reprofile the safety valve agreement, and they are not keen to do that. But what we can do is work within the envelope, as they call it, that we've been given. So we have had a number of work streams that directly affect schools, and I think through the work that we're doing, well, I know through the work we are doing, we can reduce that deficit down in order to try and attempt to meet that safety valve agreement. Some of the work that we're doing relates to looking at our high needs spend, which predominantly comes out of our EOTAS, educated other than at school, and our discretionary spend, which is predominantly on alternative provision and packages made up for children that aren't in school, and bringing them back into the school system. And that's part of the place planning work we're doing as well. So whilst we are going to close schools and remove places from the system, we are going to increase the number of specialist provision across the island, which it desperately needs. Now, we've also got to make the school system more inclusive, and I'll come on to that. On the island, you've got St Catherine's, which is an independent, non-maintained special school, but you only have two other provisions. You've got St George's, which is secondary, and Medina House, which is primary. The ILC, I need to clarify, is a pupil referral unit. It is not a special school. It shouldn't be a special school. It is for our 6-day provision and our medical, so medical vulnerable children. What we would like to do is expand our specialist provision, which is exceptional on the island. St George's and Medina House do some exceptional work, and I work very closely with those leaders to increase the number of pupils that they can support and remove the inappropriate placed children from mainstream, which won't be a cost neutral. It won't reduce our safety valve programme, but it will support children within the school system, and then bring children back from the EOTAS packages and from their discretionary spend back into the school system by being supported by the St George's staff, the Medina House staff. And then what we would like to do is look at the ILC moving forward in terms of a phased approach to these expansions and seeing how we can best meet the needs of the medical children. At the moment, medical is a huge umbrella term which covers things from quite complex autism and SEMH needs to anxiety. And you can't lump them all together because actually that would be disastrous for the children that you're trying to support. So we would like to set up some potential satellites to be able to support those complex needs in a more therapeutic way. And we believe we can do that. So at the moment, Jade and myself are looking at plotting out a phased programme of increasing places, along with the cost avoidance that will create. And we've got the estates across the island from when we changed school reorganisation before. So we believe we can do it quite a cost-effective way, and that way meet our safety valve agreement. On the other side of that, there is making schools more inclusive, because we could create lots of special school places and we would fill them, but we've also got to help our schools be more inclusive. At the moment, we've got one secondary school that has got a ridiculous number of suspensions, and they're really high, and we're challenging that school quite aggressively on that. So we need to understand, why is that school suspending pupils? Why aren't they able to meet their needs? As part of that safety valve agreement, there was a number of work streams that were put in place. Now, they were when we were in the partnership with Hampshire. Part of the work I'm doing at the moment is put them onto an Isle of Wight portal for Isle of Wight schools. So we had the conference where we launched the offer to schools. That offer consists of a free to access phone line. Now, I'm really pushing this hard. It's on the bottom of my email strips. Please go out and speak to your schools when you're out and about, because during February, not one school phoned that phone line, and they don't pay a penny to access it. So they phone up, they go online, they book a time they want the call, they get a call with a SEN expert, someone who we appointed. Actually, I appointed them as part of the role when I was in Hampshire. I set this up, who would give them expert advice on how to meet children's needs better in a classroom. And these people that are working on the phone line have been experienced SENCOs and SEN experts. So we've got a phone line. We've developed 5 e-learning training modules, which are free for schools to access. The 3rd module went live this week. They can access it currently on the Hampshire portal, but we're putting it onto an Isle of Wight portal, as I say. We've also got a SEN support toolkit that is once again hosted on the Hampshire portal, but we'll move over to the Isle of Wight, where it has free resource and ways to signpost to different support that can help busy teachers and leaders. I've just pulled together a working party to rewrite our SEN support guidance material, sometimes called ordinary available provision. It's what should be available at source for all schools. We're going to change the way we write that. Up until now, it's been quite a wordy document. What we want to do is make it a really easy, accessible guide for teachers. Teachers are busy. They haven't got time to read through lots and lots of document. We want a really simple document of, you've got this issue in class, these are the techniques and strategies you should use to help you. So we've got a team of experts from across the council, our specialist teacher advisors, our therapists. We've got some teachers that are in the classrooms to understand the pressures that they're under and have expertise within SEN to join that working party. And we're just about to launch that, or launch the process of developing it, I should say. So we've got that. We've done a parent guide to SEND, which we've rolled out and sent out to all schools. We've done an easy read version too, so that we can help parents navigate the SEND system. We've set up the PBS model, which is the primary behaviour service down at the Old Chiltern and Rookley site, which is free for schools to access. And schools speak really highly of that. They're very, very positive about the work of PBS. We have the Value in SEN tool, which the local authority, the council, have paid for 3-year licence for that. That is a tool to help analyse children's special educational needs and how parents are brought in to help understand, for them to understand how they can support their child at home as well. We've started the rollout of that across the island. We've had the SWAN project, which was from the EP service, which has now completed all the training. We need to finish off the circles the rest of this year so we can embed that work across the school system. There are other things going on, but there's quite a lot there. I just need to take my breath for a moment. The other thing to help embed this work, though, which will work better, is that as part of our school improvement offer, I've assigned half a day per school to help schools navigate all of this additional support and resource. So we're not just throwing things at them, we're saying to them, this is how you can use it in the classroom. And the people that will deliver that training are the people that are manning the phone lines. So there's a natural synergy. I've also moved those people over to deliver the SENCO networks, which we offer across the island. And actually, I've just received feedback today. So our first SENCO network went live today. I've had positive feedback already. So we've put that support in place for schools. So if we can help schools address some of the SEN needs they have in their classrooms, plus doing that targeted work, I think we'll start to see some traction in it, notwithstanding the fact we have all the other issues going on. But that's the TSEND programme in terms of the school approach. Behind the scenes, we are going to reprofile the way we're looking at the board. Our Hampshire colleagues are supporting us for the remainder of this month and they exit. We've worked a lot on our SEN support behind the scenes in terms of our statutory service and how we manage the EHCP programme and the assessment process, and actually we're pushing back on some of that. You know, there's been a history of allowing parents to say yes to everything, and actually children don't always need an EHCP, and we do need to say no to assess sometimes too. So we've done training with our workers around that. We're being a bit more robust with that. We are seeing the complaints that which you would see across the board anyway around SEN, but we need to help people understand what is and isn't feasible. And at the moment, if we say yes to everything, the debt that is accruing will get bigger, and we haven't also got the places to place children, so we would just end up with lots more children on some random packages at home, and we don't want that. We want children in school because it's a safeguarding feature, isn't it? If school is a protective factor, it's better to have them in a school building. And I'm happy to take any questions.
Councillor Bacon, I know you need to go. Good luck is all I'll say. Councillor Churchman, Councillor Lever, Councillor Outlook.
You're like a breath of fresh air. Really, I think that is fabulous what you're doing. I have a very, very severely dyslexic son, and my goodness, it was hell. Early learning difficulties, dyslexic. Anyway, so I know what some of these parents go through, and what you've talked about is brilliant, because he went to a special school to start with, then he got shoved into mainstream, and it nearly destroyed him. And there just wasn't the support. Just a question. How many children, do we know how many children actually aren't in school at the moment? And I'm talking about ones who are excluded plus home educated. Thank you.
They're two separate groups of children, because on any one day we'll have a different number of excluded children or suspended children, depending upon the school system and what's happened within that school environment. The elective home educated group of children is approximately around 600 children. However, there are a group of children who are educated other than at school. This is the OTAS label, and we do have a high number of those. We've got plans to bring them in, but once again, that number fluctuates because children cease their plans when they come to a certain age or when they become a young adult, and then other children join as well. So that number's around 70, but then we've also got about the same number approximately on discretionary payments. Now, these are children that are on a roll of a school, but actually don't go to school. They do something else, but they're not classed as EOTAS. They might do a different type of therapeutic provision outside of school. Now, those children sit on the roll of the school, so they actually form part of the school statistics when it comes to the examination results. So that's another reason why we need to get children back onto a proper role, do things in a proper way, rather than have these various packages, which actually it's not great for children. We don't want that. So we've got a plan to reduce all of those down and increase places for those children. I don't think that really answers your question, but we're moving in the right direction in terms of the numbers.
Is there any possibility, any thought about setting up a SEND school?
In our safety valve agreement, we have originally the DfE allowed us to have a free school, and we have put the money to one side for a free school for SEMH. And that's on, and it's, if you go onto the council website, you'll see all the notifications there for it. The problem we have at the moment is there's no sponsor. Any new school has to be an academy. And I've gone out and spoken to academies. They don't want to come to the island. They will only come over if they can have at least 3 schools. So our next option is to expand our current provision using the expertise we have on the island, which we do have. So that's our plan. We also do have to look at our resource provisions too within our schools, because we've got a resource there that we can utilise. We are going to, if we look at our resource provisions, we will set up resource provision networks to support them, because currently we don't have any professional development around that group of resources across the county, across the island. So we need to look at that too.
I think it's very important as well that we don't just lump SEN into one analogous group. It's very broad, as you very well understand. And I think the idea of one school, expanding St George's makes massive sense. But of the 1,600 pupils in receiving the HCP, you wouldn't make a school 1,600 kids, because it just wouldn't make sense. The idea is bring them back into mainstream schooling by taking away the fear of what school is. Where did we get to? Councillor Lever, then Outlaw, then Dan.
I'm going to follow on to that point, but just briefly, the school you just mentioned then, is that the one that was due for Carisbrooke?
The SEMH school, yeah, it's going to be used on the car park bit of land there.
Okay.
Just to reiterate as well, so councillors are clear, myself and Jade went down to meet with HISP and Carisbrooke Medina through the academisation progress to be clear around the piece of land that's within their red line boundary and what's ours, so that we've still got that land if we need to use it moving forward.
Okay, thank you. Yeah, so following on from kind of what was just being said is my concern at the moment and from personal experience and from people I know is it feels very much like we've got this I don't know a better way to phrase it right now, but this middle ground of children where their needs aren't quite as severe that they need to go somewhere like Medina House, but their schools are struggling in to keep them in mainstream. And you mentioned a lot of ways that we're trying to get that there PBS and all those things you had in place, but it didn't sound like there was perhaps uptake on some of those things from school. How do we, is that just down to the information not being out there enough, or is it, are schools reluctant? Like what are the challenges there, do we think?
If I'm honest with you, I think once we have it on an Isle of Wight portal, we have more traction. And I really do believe that. The phone line will always have to be hosted on a Hampshire portal for that. And that's about the people that are manning that being visible out there and school staff seeing them. So having them run the networks, having them run out the vSend tool will build confidence in the system. In terms of those more complex needs, the 5 training modules, which I'm happy to provide an aid memoir for the committee if that would be useful around the different resources. It's been designed by the therapy team, and it's about meeting the far more complex needs that schools aren't used to coming through now. And they're written in a way where there are 4 case study young people, and it talks through the strategies of them being in school and how we would meet their needs within the school system when you've got 30 other children in the classroom too. That the uptake from that, we've got the data around that once again. It's not high, but we are transferring them as I speak to the Isle of Wight portal, which will go live soon. So I envisage that we get a higher uptake on that.
I guess as counsellors as well, us going out into schools and telling them about these things may help that as well.
And also, we've only been in post, what, 5 weeks? And I think we've done an awful lot in 5 weeks. You know, on the bottom of my email strip, I've got all the resources on there. I'm constantly reminding people about these things. And we're out and about all the time. And actually, once you've gone in and spoken to a head teacher and you've had that face-to-face personal interaction, it makes such a huge difference, doesn't it? And that's going to be the difference. You know, we're in every day, we're out and about in schools. It's building that trust. And I think that, you know, you can't put a price on that. That's invaluable, isn't it?
I took on the role of SEN counsellor as a point of contact. So if you could send me that phone number, because there's a group, we met with Colleen Brannan, for instance, she sort of manages a group of parents, and I can encourage them to encourage their schools to take that up. If you would, thank you very much. Councillor Outlaw.
Thank you. Probably a very quick one, hopefully. I'm curious as to what the statutory override was in relation to the deficit and the accounting within the revenue budget. Can someone explain that to me, please?
Thank you for raising that, because it's great to talk about children and young people and the amazing work that Naomi and her team are doing on this. Actually, you can hear there's so much going on, but it's really important as a committee also that we talk about the money side of it. So essentially, and you may be aware of this, the government funds education through a thing called the Dedicated Schools Grant. And within the Dedicated Schools Grant, there's a block called the High Needs Block. And that money is the money that is allocated by government to local authorities to deliver their statutory duties around SEND. So, for example, funding education and healthcare plans, provision of special school places comes out of that pot. Now, the reason that the safety valve agreement has become quite common around the country, I think there's about 35 safety valve agreements around the country at the moment. They always get agreed in March every year, so we're really interested to know how many more are going to join in this March, because there will be some. Is because many local authorities are spending more than their high needs block allocation than they're receiving from government in order to deliver their statutory duties. So when in the Isle of Wight's situation, because the agreement is for roughly £12 million, and you can click on the link and you can read about it, you know, the exact agreement, that was because the forecast for the Isle of Wight's Dedicated Schools Grant back in March 23 was that the Dedicated Schools Grant would have an overspend of £12 million by the end of the agreement in 5 years' time. And that's because the council looks at the dedicated school grant as a whole. So if the high needs block is overspending, it basically means probably that the whole dedicated schools grant's overspending, because the other things are roughly flat, because the schools block, for example, is just shared out amongst schools. So the situation around the country is that some of these overspends on the dedicated schools grant are so big that if they were included on a council's balance sheet, the council would actually not be financially viable. And so the Department for Education has worked with other departments in government to come up with a solution, but it is only a short-term solution, because essentially what local authorities are finding around the country is they're spending an awful lot more on delivering their statutory duties than they're receiving from government to do so. So what's the solution to that? Well, at the moment, the solution presented by government is that they're putting these safety valve agreements in place. But even with those safety valve agreements, some authorities are actually now spending more than they thought they would even 12 months ago. So as it says in the paper, whilst 12 months ago when the agreement was reached, the forecast for 5 years' time was a cumulative overspend of 12 million. It's now more than that, and I've put the numbers in there, and I've also said in the paper, we've put in the paper, that actually we're reforecasting that again, because under the new arrangements, I think it's important that we look at the modelling of it, and we are comfortable that what is in the model is realistic. So we are reforecasting that at the moment. We're working with colleagues to understand, things like what is a realistic number of education and healthcare plans in 3 or 4 years' time. I mean, it's a very hard thing to model, but you can look at historical growth rates. What is inflation going to be on placements? So if we have a placement with a child in an independent non-maintained school, what is inflation going to be on those sorts of placements? So we need to have a really accurate look at that. Also, of course, how many children will we have in the system? We've heard that actually the numbers of children in the system may actually be going down. I will answer your question. This is all relevant. So what does the government do when it has delivered its safety valve agreement and agreed to this additional money, but local authorities are still spending more than that? And actually that overspend will sit on the council's balance sheet and potentially threaten the financial viability of the whole council. So what they did is they introduced this thing called the statutory override. And what it said was that for the dedicated schools grant, councils do not need to include the dedicated schools grant financial position on their wider balance sheet. It's like it's ring fenced. There's a statutory override, so you don't have to include it in your main accounts. That is due to, at the moment, continue until financial year 25-26. And at the moment, it isn't being extended beyond that. So the risk for any council that has an overspend on its dedicated schools grant when you come to that point is, if it doesn't get extended and nothing else changes and that overspend still exists, it will have to be included within the council's wider accounts, which for many councils will be extremely unpleasant. And that is the subject of lots of discussions between local authorities and the government, and also organisations like the Local Government Association representing and speaking on behalf of all local authorities. Because fundamentally, there is an agreement that the amount of money that the government is giving local authorities to meet their statutory duties around SEND is not enough. But they haven't yet worked out the mechanism for how it is funded properly beyond that. So we have these short-term measures, one of which is the statutory override and one of which is the safety valve agreement. I hope that answers your question. I apologise if it was a bit long.
Thank you. That was very clear. I have a supplementary to it, though. What do you think is the fundamental reason why there's such a difference between the reality and the forecast when the safety valve agreement was actually signed? Are you
For the Isle of Wight agreement, I don't know yet, because we're looking at the model, we're looking at all the parameters within that, and I don't know at the moment, but that's what we're looking at the moment, because we think it's really important in our discussions with the Department for Education, which happen on a regular basis. In fact, I'm meeting them next week to talk about specifically the safety valve agreement. It's really important that we are being realistic, with what's in there.
Councillor Downer and then Matthew.
Yeah, in paragraph 18, and it says about children's services education, working to develop a new holistic education strategy for the island. Would it be possible to broaden that out, please?
That's the education strategy that we've been talking about throughout the evening today. No, don't be silly. It's fine. It's so we just want to make sure that all of the work we're doing is underpinned by a really visionary and ambitious education strategy for the island, which encompasses all of the issues that we've discussed tonight and more. So that's the work. No, you're fine.
It's like a foghorn anyway, it don't matter, do it? Good job I can make you laugh, isn't it? Yeah, who retains the oversight of the safety valve programme now that children's services transition from Hampshire to the Isle of Wight Council control has taken place?
So that would be the Director of Children's Services and the Section 151 officer, because so it's now ultimately us in the council.
So the children's director and the chancellor.
Yeah.
Thank you.
Matthew.
Thank you, Chair. I was really impressed hearing so much of that. And one thing that particularly bugs me with the 3 or 4 schools that I work in is the amount of children that are on EOTAS that just simply don't need to be. And also those that are electively home educated, get taken out of the school, and then next time you see them, they've clearly gone backwards. It's brilliant that you want to reduce the amount of those and bring them back into school. But when you say bring them back into schools, does that mean actually targeting the ones that are out there at the moment? Or does it mean going forward producing less EOTAS in the first place? And is there anything you can do to the amount of elective home educated children to fill some of these spaces? Thank you.
It's both, isn't it? So we need to reduce the number of EOTAS packages and discretionary payments we have at the moment. We can't carry on. It's gonna blow us out of the water in terms of the finances. So we need to act quickly. We've already started with the first paper, which will go public on Friday around some of the expansions that we're starting with. And we plan to bring more to the table for you to authorise, because we need to get this off the ground. The biggest issue we're going to have, and we're really aware of this, and we need to win the hearts and minds of island families, is the families and parent confidence in the system. And also for a number of those EOTAS packages, the children that are on them, it would be unwise to try and persuade them to go into the school system that they potentially have failed at. So we need to have a different offer, a more therapeutic offer that can meet their needs, but within a different type of school environment. It's a school, because we can't get away from that. It's a building, isn't it? It has to have something totally different. And in a few weeks' time, I'll be really pleased to see many of you at the launch of the new ILC provision, where we've managed to refurbish the old primary aspect of the ILC to give it a vocational offer there. And Jay's done a fantastic job, the team have, pulling that off and actually putting a different resource in place so that we can meet the needs of children more effectively on the island. And that's really important. And it's part of this overall package. We need to have a variety of different pathways. Not every child will succeed in school. So what can they succeed in? And how can we make sure that they have something meaningful for preparation onto adulthood? So we're taking a really bold step in terms of creating these. You know, we haven't got a magic pot of money. We're having to be creative with the resources we have, but we believe we can do that. And we've plotted out within the next 18 months to 2 years, we can probably create 150 places if we get the papers lined up correctly. It's a big ask, but it would reduce that discretionary spend right down. Alongside that, we'd have to do a lot of work around parent engagement. We're already working very closely with parent voice, but that doesn't go far enough. We need to make sure we meet with all the families as much as we can and build that trust with them around what is available. And that will mean staggered transitions into some of these settings. So it will, you'll see a staggered attendance over time, but anything can be possible if you have the right offer and the right enthusiasm to go with it too.
Thank you for that, because I'm you've heard me say it many times, the school day should be designed around the kids with the highest need, and then every child will have a better day. I'm pretty sure of that. I've got a list of questions I will email you separately. I won't ask them now because it's unfair, but there were concerns of parents, but it sounds like you're already ahead of the game, because there's, as any change like this, it sounds, the fear is you're going to force my child back into school for financial reasons rather than for the good of the child. So I'll send those to you. So any further questions on the safety valve? Councillor Adams.
This may not be exclusively on a safety valve, but there's a point you made earlier. Schools must be more inclusive, which obviously there must be, and you have concerns over the amount of exclusions and suspensions. Do you know the reason why there's so many suspensions? Do we know what they are at this moment in time?
When a child is permanently excluded or suspended, the school has to give a reason for that. And on a number of those, we push back, and we are successful with that too. Rachel and her team, have got really good, robust relationships with schools. We have got one school at the moment, as I've mentioned, that has got a particularly high number of suspensions. Really high, they stand out, and we've challenged back at the school around that. And it's around their systems, their processes, and we need to make sure that they have got the right messaging, they're using the right language. There was some research some while ago to say that 60% of all of the poor behaviour that happens within a school setting or with young people is due to the adult's interaction with them and the adult wanting to win a battle with them. So if we can help the adult with their language and how they interact with a child, 60% less behaviours could occur. So we've just got to be conscious of how we support adults with that. And when we did the conferences, we had Kit Messenger come and talk to all of the head teachers, and she's written a book called Curious Not Furious, and she works with a number of local authorities around looked after children, around care leavers, with the police, around the language we use, and she modelled that really well. And we were hoping to get her to come back and do some work with our school teachers and the support staff, because it's so I can do that message with head teachers, and head teachers go, yeah, I love that, I bought the book, I've read it, but I need teachers on the ground to actually make the difference. So we're working with her quite closely about getting her come back in the summer term to do that work.
That is very, again, not wanting to get overexcited, but it's very encouraging. Having seen directly in action someone called Christina Mitchell, which does the same. That is really encouraging. Any other questions? Okay, it looks like you're nearly at the end of your first meeting. Well done. Looking at the work plan quickly, we've got all the meetings for the future are full. Our informals are full, so it's just really a question: is there anything on there anyone would like to add, move, take away? I'm quite happy with it. The informal on essential skills is something we programmed in, which we look pretty important because of adult skills, and family reunification in July and SEN direction October, and the meetings are pretty full with a lot of statutory stuff. Yeah.
I didn't know whether to raise this or not. In the Times last week, it talked about primary school children are going to school without being toilet trained. Now, if you're a teacher, I just can't imagine what this must be like. I don't know how you deal with it, but I just wanted to raise it because I do feel, from a teacher's point of view, it is so important, whether you start with a family, I don't know. In other words, it's a problem I'm sort of mentioning, and
I can actually comment on this because I've had this conversation with our early years team. So it is a national problem, and there are more and more children going into our school system that are unable to toilet on their own. We have a great early years sector on the island, and we have a fantastic team too. And we do run parenting and family workshops around toileting and helping them to support young people, young children, in learning how to, go through that potty training experience. And Teresa, who oversees that, does a remarkable job. So that's in hand. I don't think it's going to solve the problem straight away, because we have to engage in the families, and some families don't always want to engage in that. To be fair, some are embarrassed too. So we've just got it's a very careful way of managing that, but we have got support in place.
Just on the work plan is we will allow a small amount of time to do the transition every time, just because it's only fair for the committee to ask questions. We used to be able to update, if that's okay. Anything else on the work plan? Councillor Lever.
Sorry, Chair. It was just on that previous point. Can I just labour the fact, though, that some children that are in school and aren't toilet trained, it's not because of the fault of the parents, it's because there are needs there that make that so. Yeah.
Yeah, and I think as Naomi quite well pointed out, that those needs would have been addressed elsewhere before and now aren't. Members' question time. Any further questions that we've not managed to get around to yet? I'm looking at you, Tig. Okay, so thank you all. That was an excellent representation. All I would say is be ambitious. One thing that may have been lacking in previously, I say may, is the ambition. Is, you know, I really do mean average is the minimum. And tonight you've turned up, and I couldn't have asked for a more ambitious plan. Now, I don't want that to get beaten out of you. You know what it's like to start a new job. We all get very excited, and 6 months later we feel. But what I'm saying is, this committee is here to help as well as scrutinise. So please be ambitious, because our children's future is riding on you. No pressure. So thank you all.